is I think. All right. So as I was saying, Professor Bingqin is a very important scholar in the field of Chinese social policy, because she is doing a lot of international connections that allow us to know more about the very big developments that we are having in the field of social policy in China. So many people might be still unfamiliar with this kind of topic, but she was one of the initiators of this kind of conversations, because she was having a special issue about the development of the Chinese welfare state for a regional issue of the social policy and administration. So she was guest editing this special issue together with the editor, Professor Bingqin. So we could get more understanding about the Chinese welfare state. And generally speaking, she is a very active collaborator in all Chinese social policy related issues. She has had consultancy and invited talks, working in collaboration with the World Bank, with the European Union, with the World Health Organization, with UNICEF, IIED, Save the Children. And so this is a very important from an international and policy-making perspective. But she is also very prolific when it comes about academic activities. She's the associate editor of Urban Governance, and she's one of the editorial board members of the Social Policy Administration. She has opened a Chinese social policy section in the Australian Social Policy Conference. And she is a very prolific writer when it comes about issues related to social inclusion, social policy, community governance for welfare in China. And nowadays she is working on the research projects that are covering the topics of aging and community, digital technology, and employment for the disabled. All of this is done very much in collaboration with the Australian social policy academic networks and the Chinese social policy academic networks. So we are speaking about a truly international outstanding scholar who is going to have a lot to say and to teach us on these very important topics that she is doing research about. So I would like to welcome her once again, and because I spoke already enough, I can give her 35 minutes of presentation. This is going to be followed by 15 minutes of questions and answers. Her presentation is called Healthy Aging and Community-Based Old Age Care in China. So now the floor is yours, Bingqin. Thank you very much.
Thank you, Jean, for the kind introduction. And I'm not sure that I can actually teach everybody. I think probably I just share with you of my observation and thinking in this field, and hopefully it will make everybody interested in doing research and try to dig out more, because thinking about this is 1/5. I like to say that 1/5 of the world population's aging issue. And there are probably going to be a lot of challenges and lessons to learn. And it would be also very interesting for young scholars, new territories to explore. So the talk today I'm going to talk about is healthy aging and community-based care in China. This is going to be an overview of the state of change in China and the unresolved issues, and raises some questions for the future as well. So in the next 30 minutes or so, I will first discuss the concept of healthy aging and community-based old age care to be used in this talk. And also for the discussion of China, I will examine the trends and the features of aging society in China and the changing mindset of the government by looking at some key policy challenges. I will look at the resulting state of community-based old age care and the remaining issues. In the end, we try to look at future directions for changes and possibly for research as well. So the definition of healthy aging has changed over time. It used to focus on how to keep people healthy as they age. A more updated definition by WHO starting from 2015 is that it is the process of developing and maintaining the functional ability that enables well-being in old age. So with this newer definition, the discussion differentiates between keeping people healthy and align the aging process with the care system so that people get support when they need it. Even with the improved definition, a lot more research needs to be done about the state of people's intrinsic capacity. One of our students is actually doing this research. Hopefully he will be able to publish soon. And also the functional ability and the lifestyle choices at a given time. So some older people prefer to manage on their own. So here you can see that this is an older person. On here he said self-reliance. And also some other older people would like to live among a group of older people who are willing to support each other. The picture on this top right shows that it is an 80-year-old man practicing roller skating in 2015 when I visited Tianjin. I strongly recommend you, if you visit Tianjin, which is my hometown, it has the most active old age exercise scene. I have been to many cities in China, but Tianjin certainly have the most active one. This is 2015. Everyone was amazed that an older person dared to do roller skate among young people. And the picture on the right hand, below this is the same spot in 2019. When I arrived there, I realized a lot of older people are doing this roller skating. So it just shows that the people's intrinsic capacity and also their practice lifestyle can change over time. So that also raised question about how old age care can echo that fluid situation. So the varied state of intrinsic perceptive functionality and the lifestyle preferences raised the question of how can we develop an old age care system that address the need and the preferences of older people themselves. So the WHO guidelines on integrated care for older people outline the different elements of community-based care. So there's basically three of them. And long-term care and age-friendly communities, and also integrated care. A group of Japanese scholars recently in 2019 published argument saying that healthy aging needs integrated care that target the whole population rather than narrowly focusing on high risk groups. As in many policy fields, making community-based care affordable, accessible, and available to all is always a challenging issue. So let me first show you some trends and features of the aging society in China. This big picture view will probably help you can help you to get a sense of how urgent these issues have become. Policy advisors and the policymakers have raised the concern of growing old before becoming rich for quite some years in China. It's almost become a cliche nowadays. So the earliest document in China that started to talk about growing old before becoming rich was an article published by the advisory group on issues and response strategies for population aging in China. And this article argued that in 2001, the number of people over 65 years exceeded 90 million, accounting for 7.1% of the total population, marking the beginning of the era of population aging. We are indeed able to observe the fast increase of the older population. In 20 years, the number of over 65 have been more than doubled in absolute terms and close to double in percentage terms. However, a lot of people dismissed this aging before getting rich challenge in 2001 and felt that other countries also become older before they get rich. And also, what do you mean by aging? And there are a lot of debates on this. So I put this chart here to actually give some explanation of this phenomenon. It compares China's median age trend with other countries' trends. This purple data line here is China. Also the vertical line, this is 1997. This was the time when China moved from a lower income country to lower middle income country. This is 2010, when China moved from a lower middle income to a higher middle income country. And then what you can see, when China was at lower middle income country, it was already the age population, median age is already above the lower middle income country. When it reached the middle income, upper middle income country, and the average age is also kind of above average, when it even started above median, even when it just started. So over this 13-year period, when China stayed as a lower middle income country, the growth, the slope of this line of the median age is much steeper than the other lower middle income countries. So that is the type of growing old before becoming rich. And also what you can see in recent years, the aging is also becoming quite fast. Kind of trying to catch up with the higher income countries, but the China's GNI, national gross income per capita, is still $2,000 lower than the lowest of the high income country. So this is a kind of how the issue with getting old become before getting rich. And the further issue is the geographical distribution of older people within China. I plotted this older population with GDP per capita by provinces. These are the province names. And it's not difficult to see that some lower income provinces, such as Liaoning, Chongqing, and Sichuan, and also Jilin, Heilongjiang, and Shandong, these provinces are suffering from very similar level of aging issues with some of the richest provinces. This is Shanghai, Jiangsu. And this means that even within China, some poorer provinces are suffering even more severe getting old before becoming rich issue. So this is a chart that many of us would be very familiar with. Basically, the household size is getting smaller. People have less babies, and even with the relaxed one-child policy, childbirth is still a problem. So that prevents the supply of the children to become, the family care. And there are about 285 million rural to urban migrants living and working in cities in 2020, among which 170 million work outside their home countries, home counties, and 116 million worked in their home county. So even though China's urbanization rate is not the highest among the upper middle income countries, the speed of change is the fastest since China become middle income group country. So this means that at a given time, more people can be living separately from their extended families, which make it impossible for them to take up the care responsibility as before. Basically, the idea is simple, that even if you migrate, when you try to bring your family members, it takes time for you to settle down and make your life comfortable to bring your parents along, right? So the rural areas that have lost the working age population to the cities are at the same time suffer the most in terms of aging before getting rich. So there's a growing need of care, not only by number of people, but also by proportion of people. These features show some key challenges of old age care in China. These are the lower affordability issue, partly because of low income and partly because of these rapid social change made it difficult for people to adjust their consumption patterns in time. And also at the same time, the family care capacity has quickly decreased. Some regions are suffering particularly serious. As a result, the Chinese old age sector, in particular, government policies need to deal with these challenges in time. In some cases, such as poorer provinces and rural areas, actions need to be taken fast to avoid major crises from happening. Next, let's examine the policy responses to the challenges so far. I will use the fixed growth benefit mindset theory to frame the policy discussion, because there are too many policies. So the idea of the mindset is a set of some assumptions, methods, or notions held by individuals or groups. The mindset theory argues that a person or a group of people's mindset can determine the future success of their behavior. And there are a whole range of mindset theories developed. Buchanan and Kern 2017, they suggested that the mindset theory can be used in other fields, such as education, businesses, and policy analysis, beyond psychology. So the concept of mindset has been used to analyze in the behavior and decisions of organizations, either public or private organizations, or NGOs, or even the family as a social institution. There is a growing interest in how the mindset of the top decision makers or managers may affect the behavior of and the impact on the organization's culture. These are still kind of organization perspective. And we decided to use it because in China, people often compare the Chinese government with a big, giant enterprise when it operates. So the top level mindset can play a big role in the policies. However, how to determine the mindset of the policymakers? We conducted a policy analysis and found that so many government departments are involved in healthy aging policies in mainland China. And we have published a paper recently on this. It took a lot of kind of manual coding, thanks to our young collaborators. And this is only the national level policy, not local is not yet included. But the thickest line shows that two departments are playing the most important role, the Ministry of Health and also the Ministry of Civil Affairs. And the care sector is indeed playing a central role in community-based care. So, and which is under the kind of a governance of the Ministry of Civil Affairs, and of course also in collaboration with other departments. And even so, a ministry is a large organization with many different departments. As we can see here, it will also need to work with other departments to achieve the policy goals. So the thicker is the closer the collaboration between the departments. And this paper has a lot of charts. You are more than welcome to download them. So we argue that in a complex policy context, what we can realistically do is to examine the policies as they are the bargained outcomes of different departments. They can help us to understand the mindset of that underlies the collective of policymakers at a given time, and the changes over a longer period of time. So this framework includes the dominant ideology, the institutions involved, and the role of the state and the actions to be taken. So these are the perspectives. So I just give you a quick example. In a fixed mindset, there would be a preferred dominant ideology relying on existing institutions. The state stick to the same role when taking actions, when it takes action, it depends on whether situation is falling inside or outside the existing frame of references. Basically, if they don't like this idea or is not in line with their dominant ideology, they will just prefer not to do anything. This is when they face this kind of looming large crisis, such as Ijin. So even so we can just have a quick look of the changes. Even in the central planning area, the old age care policies heavily rely on the Confucianism. Basically, adult children are expected to care for their elders. And even during the central planning area, it means that the government took a minimalistic role. And between 1978 and 2010, this is after the central planning area, there had been a growing stress on neoliberalism, which focused on developing a piggy bank for people to save for their old age care. If you, even to this day, if you search the old age related literature, how to use calculating the pension system, how to use social insurance to cover the cost of old age care is probably you can get the largest amount of research. And over time, there have been various pilots in community care, but often fail to develop substantial care for the people. After 2010, the idea of mixed welfare started to grow. Interestingly, the national discourse becomes more about collectivism. Since Xi Jinping came into power. But then if you actually look at the policies, the focus implementation is more about making use of the market players to develop a new sort of a silver hair economy. So it still stayed with this kind of a neoliberal discourse. And looking at the institutional changes, we can observe a growing varieties of actors in this field, from family and state gradually developed into a network of service providers at the community level. The government stopped being service providers and become fund holders and regulators. However, the state, through its funding activities, generates incentives, introduce a set of targets that can determine the direction of services. So it's sort of the public service or public administration system is increasingly become more like a new public management system. The state use targets and indicators to direct the services. Over time, the state is more open to alternative players, in particular to the private sector and the community sector actors, showing a recognition of the state's limit. The state basically realized that we can't do everything. We need to do invite more people to come to the field. But in the state-funded sector, such as the services in the communities, the higher authority continue to prescribe the services to what you have to provide, these kind of standardized services. Also, from the action or no action perspective, we can see that between 1970 and 2010, despite of the radical economic reforms in many fields, the state was still rather conservative and was reluctant to depart from children being the primary care provider model. And if you remember, the government legislate to ask kids to visit their parents, right? And also hope the private sector can provide fee-based service and the state would focus on social insurance development. So in the past 10 years, the state has clearly come to terms with the declining capacity of the family and the low affordability of the older population. It started to be more supportive to community-based services, and hopefully it may prolong independent living at home. That is the kind of a general picture. So we go through it again. I just keep repeating it because it's there's so many things going on at the same time. So the shift towards a growing mindset at the national level since 2011 was quite obvious. And the central government expressed a willingness to address this issue in the national level policy changes in this period. Not only the state had decided to be more involved, and there seems to be an attempt to involve the greater society in caring for the older people. The focus of the reform is also shifted from financing old age care to delivery of care. New actors such as social organizations and new policy instruments such as financial innovations were introduced. These solutions are not bounded by a narrow spectrum of political ideology. The state increasingly takes on a role as a coordinator and a supporter of innovative solutions. What is more, the state and the stakeholder relationship is not as generic as before. The state is willing to lower the market entry barriers, entering different packages of PPP contracts. I visited many places. Each of them have their own models of provision. So let's look at the results of the policies. Does it meet demands? So if we look at here is basically the bigger policy context. Interestingly, here the Chinese this was Shanghai city in 2007 introduced this institutionalized care. Basically, the home-based care will have about 90%, community-based care 7%, institutional care privately provided will have long-term care, will have 3% of support. So then many cities decided to copy this model, and they have adjusted the proportion a bit, but very similar structure. And after some years of local pilots and practices, people started to question the meaning of differentiating home-based care and community-based care. People receive various community-based services anyway. The communities can provide various types of cares and become platforms for resource allocation and support services to older people. So what you can see these days, cities start to say that we want to develop a home-based care and community-based care, merge the two together. They are supporting each other. So the number of beds has been used as an important indicator to monitor performances by the government. This is one of the key indicators I mentioned earlier. So here what we can see is that the beds in care homes are more or less stabilized. The beds in communities have been growing, but the speed of growth is already slowing down. So in some communities, you can see that they are oversupply and had to shut down some centers as well. And some people complained that there are too many of them. But at the same time, you can also see that there's a great regional inequality. Not only regional, even within one city, you go to this community and the next door is a total different picture. For a large part of the country and the population, people have no access to any of these beds. So let's go back to the earlier chart. Then I try to separate them, break down a bit. What we can observe since 2013 is the growing number of old age care cooperatives in which younger older people are able to look after older people, or older people are supporting each other. So the kind of community mutual support providers are often older people supporting each other or setting up sort of informally. And they're growing in proportion. So what we can see in this chart is, in this next chart is that in terms of these beds, the daycare center, basically it shows how many daycare centers there are. They are roughly both cooperative care played a bigger role in both urban and rural area more recently. You can hear this is the daycare center, and then cooperative play a bigger role. And in rural areas, there are less supply comparing to cities. And here we look at the overnight beds. People basically have to sleep over. So this kind of supply, basically the registered, the private sector or government funded or subsidized the formal provision take a larger chunk. But then the cooperative play a smaller role. There is also this perspective that in rural areas there's a much smaller supply. Even though rural older population were more than half of the total number of older people, there are about 250 million 60 plus people, and 130 million in rural areas. So basically, but at the same time, rural area have even less supply. But in both places, they're not enough anyway. So this table shows the situation of the labor supply in the old age care sector. There are very few fully qualified social workers in China. If you can see this whole country, fully qualified social workers, a tiny number. They can, I read some comments by some local government saying that all these people can just be put in Shenzhen. Is not enough, considering that there are so many cities in China. And also, if you think about the communities, there are more than 100,000 communities in China, or this kind of residential communities in China. And look at the labor supply. So there are on average 1.5, 1.6 person in one community doing this kind of service. So you can just see the dire situation, the need to be in a quick response to this. The success of old age care depends heavily on user preferences and affordability. Given the diversity of communities, the decision on what services are needed have to be informed by the users rather than being prescribed as universal prescriptions by the policymakers. So I'm trying to talk about the issues, huh? And there are indeed unmet need, but whether the policy suggestions would be a state prescription of standardized services is not at all clear. And there could be need for greater efforts to identify the strengths of the community, which will require better understanding of the resilience and the innovation at the bottom as well. But at the same time, it's also difficult just to rely on the community resilience and the innovation. The state also needs to seek self-change to establish the right incentives to support and nurture community-level good practices. Rather than I give you several targets, everybody just build many beds. There are a lot of them are not even serviced by qualified people. And then as a result, you invest a lot of money, but doesn't actually fulfill the goal. And another issue is that that repeatedly emerged in my discussion with policy makers, the local policy makers, and including a lot of researchers, is that people often think as long as there's enough money or affordability is improved, the market will come up with solutions. I agree with this to some extent, because if you go to the Chinese market and there are people, the private sector are incredibly innovative and good at taking advantage of these kind of opportunities. But at the same time, there is what we have to remember, that there is this major issue in other countries. If you look at other countries' experience, when affordability is improved, and there's old age care crises are solved, quite often those were developed countries that can rely on international migrants who could fill in the labor gap. But China has this 1/5 of the world population. In the future, the older population would be occupy even larger proportion of the world population. It's just not possible to rely on other countries' labor to supply for such a large care market. So there needs to be quick. Seriously think about how to innovative and how to address the needs of the people. Probably addressing the needs directly actually saves some money rather than can reduce waste. So as a result, I would like to stress is that it is important to shift to a user-centered services. Try to directly talk to to older people what they need. And another perspective is that local governments continue to respond to their performance targets, which are based on these quantitative indicators. And the issue is that it has already caused the oversupply of infrastructures and beds in many places, and insufficient resources are devoted to poorer areas, and also not sufficient funding had been given to training qualified labor force. So there needs to be changes in this field. And all these issues point towards need to shift to the mindset towards a benefit mindset, which I mean is that you put the older people's needs at the center. And when you try to invest, you try to think about, the government, and they need to think about how these investment can actually benefit the people and generate results that can actually solve the problems, instead of doing this kind of a lot of these mindless investment targets meeting. Yep. So that's it, and I'd like to thank the colleagues in Hong Kong for organizing this. It's great also to meet these our older and new friends from East Asian Research Network, especially after several years of roller coaster rides. And I hope that we can all keep healthy and age well. Then one day we can meet face to face. That's it. Thank you.
Thank you very much, Bingqin. I think that it was a very informative and very rich of details presentation, and the topic is actually an immense topic. It's like one of the biggest populations in the world has modernized, industrialized so fast that we are already faced with a situation in which the familial ties and the need for care has grown to the extent that this is already a big emergency for many post-industrial economies. But in the case of China, this gives such a huge scale. Like we need the tens of millions of carers. It's really like an unfathomable task that is a very big challenge for China, and is really something that all welfare states need to pay attention to have possible collaborations and possible suggestions. So also your position from Australia, I think, is going to be very full of insights and possibilities for exciting exchanges. So we already have one question in the chat. Maybe we can start replying to this one first. There is Ansumali Park. She asks, to what extent the local governments and non-profit organizations involved in the implementation of home and community-based care in China? Oh, so she wants to know about the involvement of local governments and non-profit organizations for the implementation of home and community-based care in China.
Yeah. And basically, of course, I presented all these these are the government and the community-based care. These data are all for the community-based care. And the NGO plays kind of a major role in this. And of course, when you talk about government in China, there are these community-based service centers. And in theory, they are sort of self-governance sector, but they were actually funded by the local government as well. So to some extent, the local government played a big role. They function as the setting up the service center or platform for resource allocation within the communities. That is sort of their functions. But then in terms of services themselves, the government these days do not directly provide services to the people. They are all contracted by mostly by social enterprises or NGOs to provide this kind of community-based services. And with these, the government entered into this kind of PPP arrangement. Sometimes the government give, let's say, the building for this service center for old age care home, and NGO will come to provide services. So that is the way these kind of so that's why it's called public-private or public non-profit collaboration. So the private sector is also particularly, the private sector actually played a big role in here. And if you see a lot of new old age care homes, and particularly long-term care homes are provided by the private sector.
Okay, thank you very much. We have two more questions. One is coming from Stefan, who just raised his hand, and the other one is from Kim Boyoung. Maybe we can start from Stefan.
Yeah, thank you, Ijin, and thank you, Bingqin, for this really interesting talk. I do say I hope we don't all have to grow old before we can meet again in person, but let me ask two quick questions. I find your talk really interesting because I wasn't actually familiar with the fixed and the benefits mindset approach at all. There are interesting overlaps with the more institutional theoretical debates, I think, about ideational change and so on. So my two quick questions. The first one is about COVID. Since the conference is sort of thinking around COVID, it was quite obvious to me that you haven't really mentioned it in your talk at all. And when you presented your timeline, the final step was always 2011 to now. So is there any evidence emerging now that COVID has somehow changed the discourse or changed the benefits mindset that you described of that last period in China? And then the second related question was about this pro-action approach that you outlined, and this idea that within the pro-action approach, there is more of a willingness of governments to learn from other places. Now, you said yourself that it's very difficult for China to learn because it's such an exceptional case. So do you have any evidence or anecdotes or examples of how the Chinese government tried to look at international evidence to inform some of those policy decisions that you outlined?
Yeah. One issue with COVID is that I basically cannot travel to China. so as a result, I can only look at online. I actually feel very uncomfortable when I cannot go to the field to talk to people. You know, I did a lot of field work in the past and talk to people on the ground of what's happening. So I think probably after the COVID, there is actually an intention trying to improve the community-based services even more. And also at the same time, in terms of volunteerism, it's increased dramatically, I heard, after the COVID-19. And also there are some interesting kind of innovations I heard from people is that basically the government started to love this old people, whole government, whole society approach during the COVID-19. So after the COVID-19, what many cities, communities decided to say that, okay, everybody living in this community, we can have this kind of social credit system. If you do kind of how many hours of volunteer, we write down as a credit for you. And then you can probably use the credit sometime either in the future, almost like a time bank, or you can use the credit to get something, some support. This kind of I heard that initially, at least immediately after the COVID-19, a lot of people, the number of people who are willing to do the volunteer is actually increased dramatically. And of course, there are all sorts of different ways of comment on me. Some of my friends were saying that they basically want to go out to meet people as much as possible. So after the lockdown, and then later, whether this kind of practice can last long, we still need time to look at it. And in terms of studying from other countries, I didn't, I do not mean, please do not think that I'm suggesting that China cannot learn from other countries. What I'm saying is that because China is so big and it's local, when it's trying to learn from other countries, it needs to understand these local constraints and then try to adapt other people's good practices. So one thing I can think about is actually some years ago, we actually, I organized several of these type of trips for people coming from China to visit Australia to look at community care, community-based care, and particularly some of these old age care facilities. For example, in Australia, they have these, if you are a retired man and they are likely to become depressed. So Australia has, government has built these workers shed for them to do wood carving and help them, older men, to overcome loneliness and isolation. So these kind of, so I took quite a few people tour around Australia and looking at all different type of innovation. The people who came were very curious and really want to know about different alternatives. I think depending on level of government, the higher authorities probably want to see more innovative ideas and kind of approaches to things but at the local level, people are very keen to look at what practices and can we learn from this directly. So this, for many years, this kind of learning is a good, I think can actually, even a lot of these innovations, volunteer systems in China, I believe that quite often this comes from people who are doing, who have traveled abroad to learn. And also probably young scholars who have studied these kind of services and from other countries, and also return to China, try to fulfill their own dreams in their career. That is also part of it. So I think this kind of international kind of exchange is actually truly beneficial to humanity, both it's very important, should continue.
Yeah, thank you, Bingqin.
We have two more questions from the chat room. Kim Boyoung is asking if you can give information about elderly care institutional arrangements. He would like to know what elderly people can expect in terms of public support when they are needing care. What is the formal entitlement? The second question is from Ilan Barry Katz. He's asking also about innovation, but in terms of age-friendly cities, and he's also asking about whether there are some new policies like including older people in the workforce for care.
Yeah. So I had produced a report for this UNRIS, United Nations Research Center of Development. That in that I actually in that presentation, in that paper, I put in detailed these charts of kind of institutions, and basically the idea, in a nutshell, is that it used to be sort of a hierarchical type of service, almost administratively. Kind of a hierarchy of services in the past. And these days it's increasingly become sort of a network of service providers, not informal network, but a network of public, basically in a community, you have community center and you have service providers, and mostly private or NGOs. And then within these organizations, and they contract services from the government. And then at the same time, they also pay for, the government sometimes also contribute part to their facilities. And in terms of network, what I mean is that the government is no longer standing on top of these organizations, and it's almost like working together with them. So so that is the type of change. And of course, there are a lot of nuance in that. You're welcome to look at our report, or if you send me an email, I can send you the whole paper, the changing institutions. So the next is about old age friendly cities in China. The age-friendly city is actually happening a lot in China, and if you look at the previous this wheel, almost every part of it. Yes, here you have all different government departments trying to address. So you have, for example, the kind of housing. And there are these days, in the past, many buildings have no lift for older people to travel around, getting out of their home. When you are older, you become sort of disabled, then you would not even be able to get out. In the last several years, huge amount of money has been spent on installing lifts in these older communities, buildings. This is the main thing people were doing. And also, I think that these, in terms of traveling around for older people, there's still a lot of room to do. That is not only for older people, but also for people with disability. They share the similar situations. And also the infrastructure, there's a lot of room to improve. And also, apart from this, in terms of public space for older people to do exercise, I have to say that is very interesting. And I don't know whether that is actually the government deliberately built that spaces. I think at least in each city, the older people are particularly taking to their own hands to occupy places. And then gradually the government took approach to accommodate it rather than taking the lead. But these days, many neighborhoods many urban neighborhoods also see the positive benefit of this and decide to make initiatives to provide these kind of public spaces for people to meet. And also there's this third age university that have been particularly active. My own parents have no time to meet me these days because they have to take classes. Yeah.
Thank you for the many interesting replies. I think that the topic is so huge that actually the discussion keeps growing, and it's very difficult to give a halt to the discussion. We are actually running out of time, but I think I saw Shujun, he was raising his hand. Would you still like to make a question? Yes, and also Poyong, he was raising his hand again, but maybe because we have to finish the session, probably we can still enjoy more discussions, for example, in the break room, or in future occasions or even the email communications, waiting for the day that we are able to meet offline again, have a nice meal together, have a nice beer together, instead of waiting until we grow old to get this kind of opportunity. I think it was a very brilliant meeting, a very interesting discussion, and a very rich research topic that it's going to grow more in the future. So please, everybody stay tuned on these kind of developments in China, which is a huge challenge, but also in the rest of East Asia. The problem of social care is something that is becoming more and more relevant. We need more resources, we need more certification, more specialization. So this is something that scholars really need to engage a lot into. So thank you very much once again, Li Bingqin, for your brilliant presentation. And
Thank you.
And see you all in the parallel sessions. This was all for the panel session for today.
Thank you. Can I just say one sentence?
Sure.
Our Urban Governance Journal is calling for special issues and the kind of any social policy. I really want to encourage people from social policy field to talk about urban governance issue. So please feel free to contact me if you want to contribute. Thank you.
Thank you very much. This is actually very good news for all scholarship. And Stefan, would you like to add something?
Not really. I think, again, you said it all. I hope you enjoy the parallel sessions. Thank you, Bingqin, of course, for this really, really illuminating talk. We are trying really hard, Julie and I, to get more people to use the spatial chat. So please do feel free to have a look. I think this afternoon there's maybe a little bit more space after the parallel sessions because we have the EASP Executive Committee meeting and the FIS Governors Board. But I know that not all of you will be taking part of those. So there is a little bit of a gap there that you might be able to explore. And for sure, there's a few of us tonight that will be in the spatial chat to have sort of a social banquet gathering, whatever you want to call it. So that will be after the final panel session tonight around 9 o'clock Hong Kong time. So again, if you want to come and join in, have a bit of a nice time outside the classroom and away from PowerPoint, then you're more than welcome to join us then as well.
Thank you very much for the reminder. Everybody's welcome in there. I will also join. So yes, see you later on in the afternoon sessions and maybe also in the evening. Thank you very much for participating to this panel session.
Thank you.
Thank you.